Did you know that kidney disease can develop silently without obvious symptoms? Your kidneys are two small but extremely important organs. They filter waste products and extra fluid from your blood, help control fluid and mineral balance, and play important roles in blood pressure regulation and red blood cell production. The worrying thing is that early chronic kidney disease often causes no noticeable symptoms. That is why blood and urine testing is so important, particularly for people who have risk factors such as diabetes or high blood pressure. NIDK+1. In today's video, we will discuss 7 possible warning signs of kidney disease, explain why they can happen, and then discuss the important kidney tests you should know about. Remember, having one of these symptoms does not automatically mean you have kidney failure. Many other health conditions can cause similar symptoms. Sign 1: foamy or bubbly urine. Have you noticed that your urine sometimes looks unusually foamy or bubbly? Occasional bubbles can happen for harmless reasons, but persistent or unusually foamy urine may sometimes be associated with protein, particularly albumin, leaking into the urine. Healthy kidneys normally keep most albumin in the bloodstream. When the kidney's filtering system is damaged, albumin can leak into the urine. This is called albuminuria, or more broadly, proteinuria. NIDK. A urine test called the urine albumin to creatinine ratio, or UACR, can help detect albumin in the urine. So don't try to diagnose yourself based only on how your urine looks. If the change is persistent, talk to a healthcare professional. Sign 2: swelling in the legs, feet, or ankles. Another possible sign is swelling, also called edema. When the kidneys aren't able to remove enough extra sodium and fluid can accumulate in the body. You may notice swelling around the feet, ankles, legs, hands, sometimes the face or around the eyes. Some people develop pitting edema. This means that pressing gently on the swollen area can leave a temporary indentation. However, swelling isn't specific to kidney disease. Heart, liver, vein, medication, and other conditions can also cause edema. So persistent or unexplained swelling deserves medical evaluation. NIDK. Sign 3: constant tiredness or weakness. Do you feel unusually tired even after getting enough rest? Fatigue can occur in people with advanced kidney disease. One reason is that damaged kidneys may produce less erythropoietin, or EPO. EPO helps the body make red blood cells. Reduced EPO can contribute to anemia, which may cause tiredness and weakness. But remember, fatigue is extremely common and can have many causes, including lack of sleep, stress, nutritional problems, infections, anemia from other causes, and many other conditions. So persistent fatigue should be assessed rather than automatically blamed on the kidneys. Sign 4: changes in urination. Changes in urination can sometimes occur with kidney or urinary problems. For example, you might notice urinating more often, urinating less than usual, or needing to get up repeatedly during the night to urinate. Frequent nighttime urination is called nocturia. Changes in urine appearance, persistent foam, blood in the urine, or major changes in urine amount should also be discussed with a healthcare professional. But again, these symptoms can have many different causes. They don't automatically mean kidney failure. National Kidney Foundation. Sign 5: muscle cramps. Another possible symptom is muscle cramping, especially in the legs or feet. The kidneys help maintain the body's balance of fluids and minerals. When kidney function becomes significantly impaired, changes in mineral and electrolyte balance can occur and may contribute to muscle cramps or weakness. However, muscle cramps are also common in healthy people and can occur for many other reasons. So frequent, severe, or unexplained cramps should be discussed with a healthcare professional rather than assuming they are caused by kidney disease. National Kidney Foundation. Sign 6: persistent itching or dry skin. Persistent itching can also occur in advanced kidney disease. Why? Healthy kidneys help maintain the balance of minerals and remove waste products from the body. When kidney function becomes severely reduced, waste products and mineral imbalances can contribute to itching. This type of itching may be called uremic pruritus. National Kidney Foundation. But itching can also come from allergies, dry skin, medications, liver problems, skin conditions, and many other causes. Therefore, persistent unexplained itching should be evaluated rather than automatically attributed to kidney disease. Sign 7. Loss of appetite, nausea, or vomiting. As kidney disease becomes advanced, waste products can build up in the blood. This can contribute to symptoms such as loss of appetite, nausea, vomiting, feeling generally unwell, sleep problems, weakness. These symptoms are more concerning when they occur together with other signs of advanced kidney disease. But they are not specific to kidney disease, so proper medical evaluation is important. NITIC. Now let's talk about the important kidney tests. Here is one of the most important parts of this video. You cannot reliably judge kidney health just by looking at symptoms. In many people, early kidney disease causes no symptoms at all. Two important tests are eGFR and UACR. NITIG plus 1. Test 1 eGFR. eGFR means estimated glomerular filtration rate. It gives an estimate of how well your kidneys are filtering your blood. It is usually calculated using blood test information, including creatinine. In general, a lower eGFR can indicate reduced kidney filtration, but the result must be interpreted by a healthcare professional and in the context of other information. A single abnormal result does not necessarily establish chronic kidney disease. For example, NIDDK notes that a GFR below 60 may indicate kidney disease, while a GFR around 15 or lower may indicate kidney failure, but doctors interpret these numbers along with the clinical picture and other tests. NITIC. Test 2 UACR. The second important test is the urine albumin to creatinine ratio, or UACR. This is a urine test that looks for albumin leaking into the urine. A UACR above 30 milligrams per gram is higher than normal and can be a marker of kidney damage. NITIG plus 1. The important thing is that kidney disease isn't diagnosed simply from one number in isolation. Persistent abnormalities over time are important. For chronic kidney disease, evidence of kidney damage and/or reduced kidney function generally needs to persist for more than 3 months. NITIC. What about the creatinine test? You may have heard your doctor mention creatinine. Creatinine is a waste product that is commonly measured in the blood. Doctors use the creatinine result, along with other information, to estimate kidney filtration through the eGFR. But creatinine alone does not tell the complete story. Factors such as muscle mass and other individual characteristics can affect creatinine levels, which is why eGFR and other tests are useful. NITIC. Who should pay particular attention? Some people have a higher risk of developing chronic kidney disease. Important risk factors include diabetes, high blood pressure, heart disease, family history of kidney disease, or kidney failure. For people with these risk factors, discussing appropriate kidney testing with a healthcare professional can be especially important. NITIG plus 1. How can you protect your kidneys? The most important thing is early detection and management of the conditions that can damage the kidneys. If you have diabetes or high blood pressure, work with your healthcare professional to keep these conditions under control. Avoid smoking, follow a healthy lifestyle, and take prescribed medicines as directed. Don't start supplements, herbal remedies, or medications claiming to clean or detox your kidneys without discussing them with a qualified healthcare professional. Important final message. If you have persistent swelling, major changes in urination, blood in your urine, ongoing unexplained fatigue, persistent itching, or other concerning symptoms, don't panic, but don't ignore them either. These symptoms do not automatically mean kidney failure. The safest approach is proper medical evaluation, which may include blood pressure measurement, blood tests such as creatinine and eGFR, urine testing such as UACR, and additional tests when appropriate. And remember, kidney disease can be silent in its early stages. Testing can find problems before serious symptoms appear.